Hi, I'm Matthew Denny. I'm here to talk to you about the American healthcare system. You've likely heard warnings that the federal government is on course to accumulate trillions of dollars of additional debt. The largest cause of this debt is healthcare spending, namely Medicare and Medicaid, which provide needed healthcare to millions of elderly and needy people. Most Republicans think the solution is to cut these programs to save money. Democrats have proposed some reforms of their own, namely the Affordable Care Act or Obamacare. However, there is a better way. Currently, most people are included in their employer's group plan. The cost is shared between the employee and the employer. Unfortunately, many employers don't provide health care plans at all. Some provide plans that are too expensive for their employees, and the unemployed are left with no job, no money, and no insurance. This adds up to about 1 in 6 Americans, or almost 50 million people, that lack health insurance. With no health insurance, these people are more likely to have untreated illnesses, injuries, have unpayable medical bills, have their homes foreclosed, and even die. What about those that do have insurance? Health care for the average person costs almost $7,000 a year. Let that sink in for a minute. In fact, this is the highest cost of any country in the world, by a lot. Are we getting our money's worth? Well, in short, no. If we could say we were paying the most and getting the best care, that'd be one thing. But compared to other industrialized countries, our life expectancy is lower, our infant mortality is higher, our preventable disease is higher, and we have less doctors than average. In fact, the U.S. healthcare system was recently ranked 38th in the world, behind Dominica and Costa Rica, and just ahead of Slovenia and Cuba. So what's the problem? We have millions of smart, hardworking doctors and nurses. We spend far more money than every other country. Unfortunately, the U.S. healthcare system is a patchwork of public and private methods, corporate and political interests. The solution is a fundamental shift in how I provide healthcare. Almost every other OECD country offers universal medicine. Could we do that here? Of course we can, and here's how. Essentially what we would do is expand the Medicare program, which provides insurance to Americans 65 and over, so that it covers everyone at every age. First, we would need to figure out how much the healthcare will cost for each person. Let's look at our current spending on healthcare. We see that we spend about $5,200 annually for each person with healthcare. Then there's an additional $1,200 of overhead administrative costs and $600 of profit for the insurance companies. Remember though, this only covers 5/6 of the population. We will need to increase patient care to take care of the additional people. What about overhead costs and profits? We can predict the overhead for this program will be pretty much the same as Medicare currently is, about 5%. And of course, since it's not a company, we have no need for profit. A change to universal health care would cover everyone in the country, keep the same level of care, and save $1,000 per person every year. The question is how to pay for this healthcare program. At a cost of $6,050 per person, with 314 million Americans, the total cost is about $1,900 billion. That sounds like a lot of money. It is a lot of money. But here's the thing. The government already spends a lot on healthcare. In fact, it collects and spends over $500 billion on medical programs other than Medicare already. If we include the current Medicare taxes, we're already over halfway to paying for our universal care without any changes. Currently, Medicare is about 1.5% of your income, and your employer pays a matching percentage. Medicare was originally to cover your medical expenses after age 65. Since we're expanding it to cover everyone, we're going to change the percentages to 2% for the employee and 6% for the employer. This will fully fund universal health care, completely replacing health insurance companies and saving most people and companies a lot of money. Let's see how much. Let's take two middle-class families with different incomes. Both currently pay 1.45% of their income to Medicare, and under our plan, that will increase slightly to 2%. Both families also pay the average family contribution to their family health care insurance. However, since our universal health care plan provides for all of their health care, individual insurance plans are no longer necessary. Under the new universal health care plan, both families will save significant amounts of money while maintaining the same level of care. And they're not the only ones. All families with an income of less than $200,000 would save. This money could be used to pay off bills, make new purchases, make down payments, add to savings, and generally help stimulate the economy. Also, since healthcare is no longer tied to employment, they're still covered if they switch or lose their jobs or start their own business. Let's see how businesses fare with universal healthcare. Currently, businesses pay the same 1.45% of the employee's salary into Medicare, which we increased to 6% under our plan. However, freed from the bulk of private insurance costs, they end up saving even more money, which they can use to hire employees, develop new products, and add to their bottom line. Once again, these aren't special case scenarios. All employees with salaries less than $325,000 annually would save their employers money under this plan. In short, universal health care is good for families, good for business, and good for America. Thank you for listening.